Okay, let's see what kind of lag time we've got now. Okay, 14:25:50. Let's see when it kicks in. Well, it sounds great, but I am seeing a significant lag. Okay, let's see what kind of lag time we've got now. Okay, 14:25:50. Let's see when it kicks in. That was about a That was about a 30 second. Sounds great, but I am seeing a significant lag. Okay, let's see what kind of lag time we've got now. Okay, 14:25:50. Let's see when it kicks in. That was about a That was about a 30 second. Sounds great, but I am seeing a significant lag. Okay, let's see what kind of lag time we got now. 14:25:50. Let's see when it kicks in. That was about a 30 sounds great, but I am seeing a significant lag. Okay, let's see what kind of lag time we got now. 'Kay. Okay, how are we doing on the high-pitched noises? Okay. Okay, how are we doing on the high-pitched noises? noises.
Okay, so here's what we're going to do, folks. I'm hearing a lag on my end. Hopefully you're not hearing a lag on your end. I'm chatting with Dawn in real time. 14:32:21 on my end. And yeah, this is, but no worries. We don't have problems, just solutions. We'll figure it out one way or the other. Okay, so here's what we're going to do, folks. I'm hearing a lag on my end. Hopefully you're not hearing a lag on your end. I'm chatting with Dawn in real time. 14:32:21 on my end. And yeah, this is, but no worries. We don't have problems, just solutions. We'll figure it out one way or the other. Okay, so here's what we're going to do, folks. I'm hearing a lag on my end. Hopefully you're not hearing. How are we doing in terms of lag now? We've taken care of the shrieks. Let's do a check on lag time. It is now 14:35 Apple time. And let's see when this starts kicking in. Apologies for the dead air, folks. Again, learning as we go. So what I'm going to do is, even though there's a 30-second lag time, I'm just going to talk and I'll answer questions as they come in to me. Okay. Oh, wow. Okay. So Melanie Holmes says it's coming through great in the UK. And the question, of course, is am I the only one having the lag time? Or are you guys seeing it as well? But we'll make it work no matter what. So the question, of course, is okay, Don and I are kind of sussing things out via chat as we go. So, so right now it's great, but Don says you're not hearing anything. Yes, that's the lag time. Let's see if that picks up. Okay, 1438.20. And let's see. So the only question really is going to be how long will this buffer, right? So as I've said, we're going to third time's the charm. I'm just going to start talking, and hopefully it'll keep relaying everything I say just with a slight buffer. So as you saw on the promotional bullet when Dawn posted the my background, of course, is in molecular biology, as well as in nursing. And that little hiccup that you just saw right there is that I'm getting both I'm listening to the lag as I'm trying to talk to you, so I'm literally talking over myself and trying to suss out how to make that happen. I spend a lot of my time doing medical mission work. I've done medical mission work for many years, going on a decade now. Have worked with a lot of infectious diseases, probably most relevant to coronavirus, of course, cholera and Ebola, both of which are. And Okay, so as long as I don't have the headphones on, it's not distracting me and I can see your comments. So really for me, the only distracting thing is the lag time, and that's okay because I can't hear it. So I'm not talking over myself. So I think, again, thank you so much, you guys, for your patience. We're now, 13 minutes past when we were supposed to end, and we're just getting started. So thank you very much for your graciousness. Again, there's a lot of people at home and a lot of people sucking up a lot of bandwidth. And Facebook, of course, just revamped how they did everything. So kind of a perfect storm. But again, we don't have problems, we just have solutions. Moving right along. So a few things that I wanted to say to you about COVID-19, okay, is please send me your questions. Okay, send me your questions via chat. I'll do my best to answer them live. And in between answering questions, I'll say some points here and there. We will upload this to the YouTube channel, and to the best of my knowledge, we'll upload it to the YouTube channel. And I will monitor that YouTube channel and comments there, so you can ask after the fact. You're also more than welcome to find me on Facebook and send me questions there. But it'd be best if you could put them on the YouTube channel if it's not personal information. That way everyone can see the answers. If there's enough of an interest, we may do a fax or something like that, a frequently asked question sheet that we can publish on the website or the Facebook page. Honestly, you guys are probably better prepared to deal with this than the vast majority of the population at large. Okay? I started working with congenital diaphragmatic hernia children probably 16 years ago when I cross-trained in ECMO. My background, of course, trauma, adult trauma. My background's military and civilian. I actually wasn't a nurse in the military, but I cross-trained as a medic and specifically tactical combat casualty, point of care training, things like that. So I did get a lot of looks when I showed up in the NICU to do ECMO because everyone knew me as an adult emergency room, surgical trauma, cardiothoracic surgery, ICU nurse. And there I am working with bitty babies. But bitty babies have taught me an awful lot. Many of the principles that we use on congenital diaphragmatic hernia kids translate to adults in terms of movement, particularly because of the fragile lungs. Okay? So I treat a lot of my adult patients with the same philosophies and practices to some extent that I learned working in the NICU on congenital diaphragmatic hernia kids. And it's not necessarily, when I say you're better prepared than most people, it's not even necessarily congenital diaphragmatic hernias, but having medically fragile children. And then, of course, when we talk about congenital diaphragmatic hernia, because we're talking about lung issues, that's the one big thing that everyone keeps going on and on about with COVID, of course, is the ARDS-like phenomena. ARDS being, of course, acute respiratory distress syndrome, if you haven't seen the acronym spelled out. Okay? So acute respiratory distress syndrome. There's a lot of evolving practice as far as that goes. Laura's asking, how have you seen the current situation affect children with lungs breathing issues? And Laura, I've got some good news for you, and it'll be really easy for you to find. One of the things we're making a big deal about right now is that we had a child with cystic fibrosis successfully navigate this, full-on COVID infection, everything. And that's what I mean when I say, to some extent, you guys have an ace in the hole. You're hyper-vigilant, and you're used to dealing with lung issues, and you're used to dealing with infection control issues to a much greater extent than the population at large. Okay? I run a consulting business to support my medical mission work. I have ongoing medical mission projects in 3 countries on 3 continents. So I'm constantly traveling. And I can tell you that prior to COVID, the population at large, horrible day-to-day infection control procedures, all over the world. And that's how things like COVID spread. Okay? Probably the biggest, okay, Dawn's saying that she would like a frequently asked questions. So again, you guys feel free to send your questions, and you can send them to me live, but also after the show. Go ahead and ask your questions on the YouTube channel, because that'll create a permanent record there as well. And then we'll see about doing a frequently asked questions, some sort of document or something we can pin somewhere so that other folks can refer to it, whether they click on the live link to YouTube or they just visit wherever Dawn decides to host that information. Again, I'm here for you. As parents of medically fragile children, probably one of the biggest things I want to tell you is I don't want to be cavalier about it. But again, as I said, you're more used to dealing with situations like this than the general public and the population at large. The main thing that you have to worry about with congenital diaphragmatic hernia is simply infection control. That is the main thing. I will tell you, as a healthcare professional, and as a healthcare professional who was a scientist first and then subsequently trained as a nuclear engineer and then went on to do other things and eventually made my way into healthcare, there is an incredible amount of misinformation out there. Whether it's mainstream news media, it's popular science channels, it's healthcare quote-unquote science channels. Probably 95% of the traffic that I get in my inbox or things that I see online, there's one or more factual errors in it. And these are things that are, out there that people are looking at and referring to for references. It's not that COVID's not serious. It's not that you don't have a medically fragile child. It's that infection control is key. Avoiding exposure, infection control. Okay? So I keep urging people to be calm. Okay, it's as long as you're doing the right things in terms of personal hygiene, yourself, your environment, self-quarantining, you've got minimal risk. Okay, and that's the key. Like, as a healthcare worker, I've dealt with things for literally decades. So I have my own little personal regimens, when I come home, to make sure I don't bring things from the hospital into my house. Taking off my clothes, in an anteroom, things like that. Having shoes that don't come in my house, that I can take off and on. Wearing shoe covers here and there, just all kinds of little things, little rituals for wiping down surfaces and keeping things squared away. And if we need to, we can post some of those things. So again, the big thing that I would like to advise you on, I know it sounds silly, it sounds patronizing, whatever, but again, a call for calm. Okay. And if a child with cystic fibrosis can certainly survive it but thrive, that also gives us a lot of hope, of course, for our own patient population and their compromised lungs. All right, we got a couple questions here. Rayanna, if a person has been on ECMO, can they go on it again later? Absolutely. I mentioned that I do one of the patient populations I work with, cardiothoracic surgery. Yeah, absolutely. You can recannulate someone at a later date. Have there been reports of kids, babies, teens with CDH who got COVID? I did a literature search and I was not able to find any. Danny Press is asking, have there been any reports of kids, babies, or teens with CDH who got COVID? Okay. And speaking of babies, or I should say fetuses, I'm going to take Danny's question and expand on that a little bit more. One of the big questions is that, can it be transmitted in utero? Is there what we call vertical transmission between the mother and the child. And there's a growing body of evidence that is saying absolutely not. So, one more safeguard there is it's not transmitted transplacentally. Okay. Primary key signs of COVID in our kiddos. Tiffany's asking key signs of COVID in our kiddos that we should keep an eye out for. So, yeah, obviously, CDH kids don't always show clinically by the book. Fortunately, right? Fortunately, we don't have CDH kids to look at with respect to COVID. There hasn't been, I was not able to find any case reports in the last few weeks on COVID, and I haven't seen any out of China either for children with congenital diaphragmatic hernias. Okay? Now, one thing I want to point you to, I know you've heard it a million times, it's all over social media, but I want to direct you to a very specific area, is Center for Disease Control, so cdc.gov. I don't know if you guys are aware of it, but they actually have a section on there for medically fragile patients. So I'm just going to throw a few things out there and then answer questions as they pop up. So cdc.gov, okay. Signs and symptoms, so far, again, because there's not any reports of CDH patients, your signs and symptoms are the same as everyone else's, okay? Signs and symptoms are the same as everyone else. We talk a lot, you've heard me talk about infection control. Another big topic of conversation, of course, flattening the curve. And we do that a few different ways. I can't emphasize enough, often when we have chronically ill children, right, you often have caregivers, right, whether it's in the family or you have, folks assigned to you or folks that you've hired, etc. No strangers belong in your house, okay? Cannot emphasize that enough, especially with medically fragile children, okay? Dawn has found at least one case of CDH in COVID, okay? So she'll send that to me offline. And what else have we got? We got a 24-year-old CDH daughter, works at Walt Disney World. Okay, very little information on her condition, medically normal, no asthma, super concerned. Would previous CDH make her more at risk? So that's a really good question, Jenna. And honestly, probably not. Okay, probably not. Okay, the people that are going to be at risk with respect to CDH, it's the same across the spectrum of patient populations. Okay, and that is if you have a current active problem, you're more at risk. Tiffany, okay, nice that Tiffany asked. Tiffany, we're going to put this in the fact. Hey, what is your regimen exactly? Our grocery stores are high risk, and I actually pulled an article on things to do at the grocery store. So I'm going to kind of work my way through some stuff here, and I'll touch on that. And yes, I can show you some specific routines, give you some illustrations, write down some things about different types of cleansers, things like that. Okay. All right. Tara is asking, CDH son exposed to a positive COVID-19 patient, statistical risks of him getting infected. Now, exposed, Tara brings up a really good point indirectly here. When I started off by saying a call for calm, there's a lot of words being thrown around in the media, okay? Exposed, what do we mean by exposed? Did this COVID positive patient, did they cough directly in your son's face? Did the son inhale droplets? COVID is primarily transmitted, droplet transmission. So I can't give you exact statistical risks of him getting infected, but as long as, and it also depends on the viral load of the person. So you can pop positive for COVID, but actually have such a low viral load that you're not infectious, and vice versa. Okay, you can have people asymptomatic that have a high viral load and are infectious. So just because they were COVID positive doesn't mean they have enough viral load to be infective. So I can't throw a specific number out there in terms of statistical risks of him getting infected, because I don't know what exposed means. If it was just something in passing and there was not a significant amount of exposure to droplets and fomites, fomite, of course, when a droplet precipitates out on a surface and remains, as long as there wasn't, significant time and touching of the mouth, the nose, the eyes, things like that, probably good to go. Okay. And yes, Danny, we will make that information available on for the CDH survivor. Okay. Julie is saying, my concerns after the lockdowns are over and things are back to normal. Virus will still be out there. How best do we proceed normally with life other than what we usually try to do to prevent sickness? Really great question, Julie, and you've actually hit the answer. Okay. A lot of what we do for COVID is just like how we would clean a room or flu or another infectious disease such as CF, right? So you hit the nail on the head. You basically do what you usually try and do to prevent sickness. And as I said, it's a catch-22 with you guys. When we constantly deal with medically fragile children, like I work with boatloads of special needs kids in Haiti, etc., we're hyper vigilant. We can't help it. We have to be. But that's honestly the best instance. So your normal hypervigilance is actually going to give your loved ones a much greater chance, right, of not contracting the disease than the population at large. Okay. Vanessa Pretty. So in other words, yes, do what you usually do, Julie. That's a great attitude. And one of my key points. Okay. This is not Ebola. There's reasonable precaution results in reasonable prevention. Vanessa Pretty, I am a frontline worker in an acute care hospital who's been designated as our region's COVID center. All COVID patients coming to us. Son surgeon told us that he isn't at increased risk, but he would be at high risk for poor clinical outcome. And again, it really depends. And Vanessa brings up a good point here, and something that I do want to emphasize is that you're well aware that CDH comes in a huge variety, a big spectrum of different degrees of pathology. So it's not CDH in and of itself. It depends on the severity of the CDH and how medically fragile the patient is. So this live cast and the facts that we post and things like that, every patient's unique. Their healthcare team are the best people to ask about unique concerns, right? So I'm glad that Vanessa's talking directly to the son surgeon. High risk for poor clinical outcome. Again, that varies patient by patient and where they're at in the disease process. Some of the patients that were mentioned earlier by some of y'all, again, not going to matter. Surgeon said I shouldn't have a problem remaining on the front line with my son at home because children are not significantly affected by COVID. Again, that's what the data now says. I personally, again, I would like to be a voice for calm, but there's a difference between being calm and being cavalier. Just because we don't have a lot of data on children getting COVID, exactly. And the next sentence, unfortunately, there isn't much data out there on children in general, much less how COVID affects infants with hypoplastic lungs. Okay? So yeah, that's why we're going to be posting some things about how to enter your house. I just gave a webinar 2 weeks ago where that was a significant part of the content, was how can healthcare workers, frontline healthcare workers, protect their families. So we'll post some of that information on there. And Vanessa goes on to say, I have a hard time believing my exposure wouldn't be a significant risk to my son's lives. Surgeon statements are also contradicting. Common sense would indicate to stay away from either my son with a decreased lung capacity or my job. What is your opinion? I can't argue with that, Vanessa. I absolutely can't. And for example, one of my friends is an ICU nurse with a newborn who was having some jaundice issues, etc. And this guy's frontline ICU worker, and he basically just took an extended leave of absence because he wasn't willing to expose his newborn to whatever he had at work, whatever he encountered at work. Each situation is unique, and there may be opportunities for you to explore different roles at work that would reduce your risk of exposure. As you said, the other option, right, is to stay away from your son. A lot of healthcare workers are doing that. There's a lot of temporary facilities being put up, or healthcare workers staying in hotels and basically self-quarantining away from their families. So the different solutions that you propose are absolutely, the best way to win a bar fight is don't go into a bar. Okay, so I can't argue with what you're saying. If you take reasonable precautions, entering your home, things like this, there's really minimal risk. But if you want to minimize that minimal risk even further, absolutely modify your job pattern so that you're not exposed to these patients, or modify your living pattern so that your son's not exposed to you. And that would reduce the risk even further. Okay, it looks like we've got the link here. Okay, it's CNN. Hang on. I'm scrolling through this link. I'm not seeing anything in here about congenital diaphragmatic hernia. I'm not sure if that was the right link. We'll see. Okay. Heidi replying to Julie, this is our concern and particularly with the medically complex young adult on part-time non-invasive ventilation support. Yeah, absolutely, Heidi. These are worried about. And Danny, I agree, evidence-based. I'm not sure if that was even the correct link, because I'm doing a search in that article right now. I think that link may have been a mistake. No worries. Don't worry, Danny. We'll get you something. Okay. We'll make sure and put the link to the patient in the frequently asked questions when we discuss it. And it sounds like kind of like what we're doing here is I'm throwing some things out there, and then we're accumulating a list of things to put in the frequently asked questions, which, quite frankly, that's a lot of things I had set aside that I thought, well, hey, this is what, if your child was a patient of mine, this is what I would want you to know. When we talk about flattening the curve, a lot of you guys, you've probably already seen this, just depending on how your appointments work out. We're moving to tele. Okay, so anything we can do to reduce exposure. Okay, so think about anything that can be done by video, and there's a few. When we think about things that can be done by video, we'll come back around and revisit that, not just in terms of physical health, but also mental health. CDC, of course. Let's see. Okay, let's keep going here. Okay, so Dawn's answered the question. Let me scroll up. I don't want to miss Corey. My son is a CDH survivor, pretty healthy, does have asthma, terrified of the virus. Hun, please don't be terrified. Please don't be terrified. I don't want to minimize your concerns. you're a parent of a medically fragile child. You've been through all kinds of incredible things to get your son to where he's at now. However, as I've said before, and I'll keep saying again, as you said, he's pretty healthy, but does have asthma. And, it's very funny how rapidly this is evolving, because 3 weeks ago, I did a couple of these webinars for healthcare providers. I actually teach mechanical ventilation and deal with asthmatic children a lot. I travel all over the world conducting seminars for physicians as well. So kind of atypical in that regard relative to what you might expect from a nurse. So 3 weeks ago, I was saying, hey, yeah, non-invasive. People say, oh no, you couldn't use non-invasive. I'm like, no, actually, you do need to use non-invasive for multiple reasons with respect to the ventilators. And in just 3 weeks, things have come full circle, and people are now saying, hey, use non-invasive, use your CPAP, use your BiPAP. Right, we just have to be careful about the droplets, the fomites. Corey, I don't feel, again, as I mentioned earlier, we just had a child with pretty significant cystic fibrosis survive this, and not only survive, but thrive. Okay? So, yes, having any comorbidity puts you at more risk, but he's got you on his side, and that's more than other folks have. Vanessa, what are our thoughts on CDH children receiving this vaccine? Should it become available? Yeah, absolutely. Absolutely. You're going to have a hard time. And you have no way of knowing that one of the things I specialized in as a molecular biologist, molecular biology is founded on immunology. So most healthcare providers who do have a significant background in immunology, which again is kind of atypical unless you specialize in it, are going to be pro-vaccine. Okay, so unless there's some specific contraindication to the vaccine or the adjuvant that the vaccine's packaged with, absolutely, no reason why the child shouldn't receive it. Okay? I've received every vaccine known to man, and some of them I've tried to get multiple times, just because immune memory can wear off. Karen, you live in Toronto. Congratulations, one of my favorite cities. My baby sister's Canadian. Okay, my son will be entering grade 1 in September. Schools are open in fall. Should I consider keeping my son home for an extended period of time following the opening of school to be safe? Oh, okay, this is a tough one, Karen, because I always say that, daycares and nursing homes are the best places to pick up diseases, closely followed by hospitals and military barracks, right? Anytime you have people packed together, in close quarters, it does increase risk of transmission. That being said, I think you're going to find that when we go back to school in the fall, that people are going to be much more conscientious. For example, the way that we broke Ebola during the last outbreak was there any public building out there, you had to wash your hands like 4 times to get in and out of the building, and the same thing for schools. So I suspect, especially in Canada, I suspect you guys are going to be very proactive about infection control. So I may joke that, the schools are a great place to pick up diseases. I would say, look at the situation, because again, I don't know much about your son or how medically fragile he is, but as long as they're doing proper things for infection control, it could go either way. So I would at this time, I would not rule out letting him go to school, but at the same time, I'd have a backup plan to the backup. Again, Boy Scout, military, right? All weird. We make sure we do all of that. Okay. So where are we at? Beth, since stores are all out of disinfectant wipes and sprays, what do you recommend for disinfecting? Dilute bleach solution. And Beth, we will absolutely put that. We will absolutely put that in the frequent. Okay, absolutely. I'll show you how to make some common cleaning solutions, things like that. Okay, no worries. And that's okay. Tiffany, my son has chronic lung disease, asthma, pulmonary hypoplasia. Yeah, absolutely. We totally have to. Totally, he is definitely at increased risk. At first sign, do you recommend the inhalers? Okay, Tiffany, I'm not exactly sure what you're asking me. I think you're asking me, could the inhalers hurt him with respect to COVID? Okay, um, and the answer is probably not. In fact, the one big thing that I've been advising, and we're kind of coming around the corner now, but 6 weeks ago, 8 weeks ago, I was advising people with special needs children to stockpile their medications, right? You don't need a ton of toilet paper, but you do need your medications. Right now, I have not seen any evidence at all that any of these inhalers makes a patient more vulnerable to infection or that it worsens the course of the disease, which is what I think you're asking me. Okay. As far as Tylenol and Advil, the jury's still out in that regard. And that's a perfect example by what I mean by misinformation. Okay. It got reported all over the place that such and such was the case and such was the recommendation, when in fact, none of those things were the case. It was a theoretical remark made in passing by a French healthcare provider that then got picked up and distributed as fact and as policy. Okay, so I think that's the incident that you're referring to that's feeding into your question. Okay, and no, there's absolutely no reason not to use inhalers if that's what you're asking. Should we be concerned with the lack of testing from our local health unit? So Aaron's asking, should we be concerned with the lack of testing from our local health unit? No, absolutely not. I'll explain why in a moment. Seeing as our CDH baby has had every symptom, we contacted our region's health and family, and they're only testing healthcare providers or if you call 911 and need help with breathing. Aaron, I don't know exactly where you're at. That doesn't sound right. But again, I don't know where you're at. But here's the thing about the testing, okay? And I've actually edited a book on laboratory tests, okay, for healthcare providers. So when I tell you this, know that I'm not just talking as a nurse, but also as someone who specializes in lab medicine. Okay. The thing you need to ask about any test, and one of the things I always teach my baby doctors is, okay, you want to order this test. How is it going to change anything? Okay. And the main reason that we test, like the COVID test, that test is based, the ones that are currently being used in the US are based on detecting viral genetic material and amplifying it through a technique colloquially referred to as fingerprinting, right? You probably heard of DNA fingerprinting. Well, this is an RNA virus, so we're essentially doing RNA fingerprinting. The question you've got to ask yourself is, how is it going to change anything? There's no treatment specific for COVID. We're doing symptomatic management. So in other words, he's going to get the treatment for his symptoms, whether he is positive for the virus or not. Okay. The only reason, the main reason to test for the virus is epidemiology, contact tracing, right? And we're not doing active contact tracing in the United States, right? We're just saying, oh, well, if you know you've been exposed and you're asymptomatic, self-quarantine. If your symptomatics cross a certain threshold, come to us and we're going to admit you. So, in other words, with your son, whether he's positive or not, isn't going to change his management. Once his thresholds cross a certain symptom, he will then cross the threshold for admission. Okay. John, yes. And again, I hope I'm doing the best I can to answer everyone's questions. And please understand, guys, I've worked with medically fragile children for going on 20 years. I very much value my parents, my healthcare teams for each of my children. So I'm answering your questions as best I can, but please don't think I'm being dismissive of your concerns. I'm not. I'm just giving you straight, honest answers. Okay. And you're welcome to contact me offline or post additional notes on the YouTube post, etc. Okay. I'm more than happy to answer follow-on questions. Please don't feel like I'm being dismissive, because I'm absolutely not. I'm trying to read every person's comment and give you a complete and honest answer, not just as a nurse, but as a nurse who specializes in infectious disease and has a background in molecular biology and immunology. Joan, my son is a 20-year-old CDH survivor, works at a grocery store, so of course I want him to quit. He is out in the public. And Joan, actually, you have a valid concern. I don't know what sequelae your son has from his CDH. I don't know if he's essentially a healthy 20-year-old young man, but you're absolutely right that working at a grocery store is increased exposure, and even going to a grocery store, right? That's one of the reasons why that was one of the resources I pulled for you guys ahead of time, is how can you safely navigate going to a grocery store. So I'll post that with our frequently asked questions, and hopefully that'll help you. Okay. Now, one thing I did want to mention before I answer Danny's question on RSV, okay, CDC, when we talk about the grocery store, of course, we're also talking about distancing, right? Social distancing, flattening the curve, right? The CDC is now recommending that if you're in close contact with people, wear a mask. To me, it's very obvious, but I'm a healthcare provider. But let me just throw this out there. Please do not put masks on babies. Please, please, please do not put masks on babies. The CDC specifically says do not put masks on infants, okay? The problem with putting a mask on an infant, they can't fix it themselves. They can't adjust. They can't work with it. So they rebreathe the CO2 that accumulates on the inside of the mask, okay? So yes, the CDC is recommending masks. No, please be careful about putting masks on your babies, okay? And Joan, we will absolutely make sure and post something about safely navigating grocery stores, which will not only help all of our parents of CDH kids, but also hopefully give your son some ideas about how to protect himself at work and how to safely come home at the end of a shift. Okay, because you are right to be concerned. Danny, do I think the RSV vaccine could prevent or decrease symptoms of COVID? In a word, no. Okay. So the RSV vaccine, when we talk about making vaccines, we're making them for specific parts of a given virus. And in order for one vaccine to work on another virus, it has to have a similar antigen or epitope for the antibody to recognize. Okay, so in this case, you're talking about a couple of dissimilar things. Now, that being said, any vaccine is going to ramp up the immune system, and you can have symptomatic reactions to vaccines. I don't think it's going to have any interaction with COVID. Anything you saw from the RSV vaccine would be from the RSV vaccine in and of itself. It's not going to prevent COVID or decrease the symptoms, right? Because remember, our vaccines are preventative, not symptomatic management. So the first half of your question's good. Back half, we're not going to see vaccines decreasing symptoms, period. RSV vaccine, probably not going to prevent COVID other than the general immune response that it's going to provoke. Okay. What do we got? Okay, Joan. Okay, so Joan is asking, will a CDH survivor receive the same treatment as a regular person that hasn't had any lung condition? Now, so there's a lot of questions. Again, I'm not going to beat around the bush on this, Joan. Every hospital, every unit has their own policies for allocating resources. And I don't know anything about your loved one in particular. Okay. So it is going to be on a case-by-case basis, not case-by-case necessarily on the patient, but case-by-case on your healthcare team. Okay. There's always talk in a pandemic about rationing resources. I will say, I don't think your child will receive substandard treatment. And something I will say that you may find encouraging is I mentioned that COVID is evolving rapidly. Well, now people are realizing, oh my God, all of this stuff that we were doing with ventilators, we're doing wrong, right? And that a lot of COVID can actually be managed with non-invasive ventilation. So I think we're going to find, and we're ramping up ventilator production, I think you're going to find that resource rationing is not going to be as dire as the media is making it out to be. Don't get me wrong, we have some very real concerns. And when you're like me and you work in places like Haiti, yes, I have to make those kind of choices. I've literally stood at a child's side and handbagged them for hours on end because I didn't have electricity, or I had one ventilator and I had 3 children. It's always a possibility, but I think that I don't think anyone, blanket statement, I don't think that CDH substandard treatment unless you're in a very resource limited environment. Okay. And if you have concerns, the best thing to do is take it up with your child's pediatric ICU or neonatal ICU. Okay. Kitchener, yes, my baby sister used to live in Kitchener. Okay. And Aaron, I'm sorry, I'm talking. Okay, lack of testing. I see what you're doing. You're responding to where I'm at. But yes, I've answered your question as far as lack of testing. Tiffany, could they hinder? Similar to how Advil apparently does. Again, be careful about saying that, Tiffany, because Advil doesn't apparently hinder. Okay. So again, we're rapidly finding things out. In theory, anything's possible, but honestly, the vast majority of theories that have been put out there, with the exception, of course, of our chloroquine derivatives for malaria and a very select few antiretrovirals, they've not panned out. Okay, so by and large, we're safe. But with any medication and any patient, any healthcare provider worth their salt is going to tell you to, monitor closely and consider discontinuing a medication if you see worsening of symptoms. Okay, so in theory, anything's possible. In reality, no causative links have been dealt with the things that are being discussed in the media. Okay, Stephanie, my grandson is a CDH baby. I'm a nurse, long-term care. Length of time. Yes. So Stephanie, if you're thinking about self-quarantining, 14 days is the general accepted amount. And if you want to be extra sure, extra long. Okay? And again, CDH baby, don't know the specifics. I'm assuming hypoplastic lungs, etc. Discussing minimizing risk. I would say 14. If it was my grandson, 14 days, bare minimum. And I would probably consider longer just because I err on the side of caution. Probably not the answer you wanted to hear, but if we're going to talk about absolute risk reduction, very similar to the question we got earlier about the frontline healthcare provider with the CDH son. And I said, hey, bottom line, if you want to reduce risk, change your job, or don't come home to your kid. You can minimize risk by observing improper infection control procedures, but minimizing contact minimizes risk even further. So 14 days bare minimum. Vanessa, okay, follow-up. Son was considered a mild CDH case, did extremely well at home. Would I agree that he's at high risk for poor clinical outcome contracting COVID? If I take everything you said at face value, Miss Vanessa, no. I would not agree that he's at a high risk for poor clinical outcome, okay? Because you're saying he did extremely well, no supports, otherwise healthy. So, no. Regina, yes, this question has been asked many times in many ways, and but don't worry, your question's just as good as anyone else's. It really depends. It's a case-by-case basis. And as you're well aware, CDH runs on a spectrum. So our kids with active problems are more likely to be affected. Our kids without active problems or mild CDH to begin with, less likely to be affected. Okay? And that's why the key, if I could only get you guys to do one thing, the key is infection control, infection control, infection control. That's why we're going to post those resources on how to safely go to the grocery store, how to safely enter your home, things like that. Okay, and feel free. I know all of you guys know Dawn, so feel free to send Dawn questions as well. Okay, and we can continue adding to the list whatever we need to do. Okay. What do we got? And sorry, I'm demonstrating horrible behavior here because you see me keep touching my nose. But of course, part of that is because I'm constantly trimming my beard and mustache for proper fit for a mask. And I've got like a little tiny beard trimming that keeps flipping up in my nostril or something. Too much information, TMI. Okay, we've touched on this already. Just wanted to let you know why a healthcare provider is exhibiting such horrible technique there and touching their face. Do as I say, not as I do. Don't touch your face. All right, what else we got? I'm looking. So I've already mentioned cdc.gov, and specifically if you go to cdc.gov/coronavirus, you're going to find tons of information there. If you look off to one side, the part that I mentioned for you guys is people who need extra precautions. So if you go to the CDC website, they're not going to say CDH child, or any particular specific medical condition, because medically fragile is medically fragile. So what you're going to find when you go to cdc.gov/coronavirus is what you're looking for is people who need extra precautions. Okay, that's what you want to look for. Okay, and it's going to tell you many things. Okay, as far as effective ways to isolate, self-quarantine, not bring, to minimize risk in terms of who and what you bring into your house. Okay, so very specific guidelines there from the CDC. Fomites we've discussed. Again, I cannot emphasize hygiene enough, and we're going to post specific guidelines. In fact, you know what? I'm going to say it live here just because I think I've answered every question so far. If I have not answered your question, I sincerely apologize. Please just retype it. But I believe I've caught everyone so far. So hopefully I answered your question, Regina. I'm going to throw this out there. Now, it's not as bad as CNN, but it is what I refer to as pop science, pop sci. The website is Live Science and How to Shop for Groceries During the Pandemic. Okay. So Live Science, How to Shop for Groceries During the COVID-19 Pandemic. If you want something you can look at right away that's going to give you tons of information that's applicable across the grocery store, but also also just maintaining hygiene going in and out of your house. Okay. So again, live science, how to shop for groceries during the COVID-19 pandemic. We'll put that link in the frequently asked facts, but also putting it out there. Okay, I've got some questions coming in. Let me take a moment, scroll up, make sure I'm scrolling back up to Miss Regina. Okay, next question down. Tiffany, is quarantine 14 days after last sign of symptoms or flat 14 days? So the entire course, what we call the natural history of a virus, or any particular disease, but we're talking about a virus here. So the entire course is generally 14 days. There is evidence that you can still be infectious after 14 days, which is why I mentioned consider 21. Okay, but generally, from time of infection to symptomatic resolution is 14 days. Okay. Danny Press, did I mention puffers are safe and not linked to worsening COVID? I had a question on that, Danny, and that was exactly my advice. Okay. I'm not sure where you're coming from with that. If you're saying, did I say that? Yes, I did. Or are you asking me to make sure I addressed it? Yes, I addressed it. So Danny, hopefully you're following this, and hopefully I'm addressing your concerns. If I didn't, just restate your question and I'll be happy to take another swing at it. Dawn, my daughter is a 16-year-old CDH survivor, very high risk. Yes, hypoplastic lung, pulmonary hypertension, chronic lung disease. I only leave the house. Okay, live on clothes and hair. So a lot of the information, so Don's got a very good question here, and this is why I keep talking about hygiene, and while I'll talk about different disinfectants and things like this. Oh, another thing you can use, I mentioned you could make a dilute bleach solution. Okay, you can also use isopropyl alcohol. Isopropyl alcohol, hydrogen peroxide, things like this. One thing you do need to be careful of course, is what are you putting these things on? So that's why we recommend isopropyl alcohol, because it's generally safe for most surfaces. Now, when we talk about disinfection, though, let me make something very clear. It's a very commonly overlooked thing. These things need to stay on the surface anywhere from 10 to 30 seconds. Put it on, wipe it off. Okay. Isopropyl alcohol, yeah, absolutely, at least 30 seconds. Okay. And so can't emphasize that enough. Dawn saying, Dawn's basically speaking to exactly the whole thrust of this lecture. Dawn Danes, who posted the last question, is, what can we do to minimize risk aside from self-quarantining? Good infection control. I only leave the house to get groceries. We're going to post something on that. Heard COVID can live on clothes and hair. Yeah, but if you're washing your clothes and hair, you're good to go. Okay. And absolutely nothing says that you can't put a hairnet on. And protect your hair. As I mentioned, I frequently change clothes when I come from the outside to the inside. Now, I'm very fortunate. My house is a healthcare worker's dream, an infectious worker's dream in terms of infectious disease, because I have a carport and a back porch that leads directly to a mudroom and a washing machine. So I can totally remove my clothes before I ever actually enter into my house, completely out of view of my neighbors. Okay. So that's something you need to think about, Dawn, and that's exactly why, not redesigning your house, but wearing layers of clothes that can be removed. That's exactly why healthcare workers do things like wear protective gowns, right? The gown can come off and our scrubs stay clean. Okay. I sanitize my groceries, change my clothes, shower when I come home. Am I overreacting? Gosh, maybe I should read your whole question before I start to answer it. My apologies, Don, but I think I just answered your question. You are not overreacting. This is exactly what you should be doing. And I don't know how long you've been listening, but this is what we've been saying the whole time. Okay. And you actually have a secret weapon, believe it or not. My CDH parents, you guys are more prepared to handle this. Don't blow it off. Don't be blasé. Keep doing what you're doing. You're more prepared to handle this than the population at large because you're hyper protective of your children. Okay. Now, I'm occasionally I'm occasionally seeing a angry face float up there. I don't know if that's a typo or something, but please feel free to chime in. I have absolutely no ego in this, and no one knows more about your child and your circumstances than you do. So if I do see one of the frowny faces go up, hopefully you will follow that up with a comment that is letting me know your concerns. Okay, because this lecture, it's not a lecture; it's a conversation. This conversation is all about you, and it's all for you. Okay, so please don't hesitate. Okay. Yeah, exactly, Danny. I'm not trying to. Danny Press is saying, "Yay, CDH parents, we got this." Again, I'm not trying to be blasé, but honestly, you're in a much better position than most folks are. Okay. Um, let's see what else. Some other things I wanted to mention, and some of this is on the CDC and World Health Organization websites. Don't forget the psychosocial aspects, and there's multiple things to think about here. Many of you are used to having kids at home, but many of you may have relatively healthy kids that have been out and about, and now they're forced to be at home. Don't forget the psychosocial aspects. In terms of talking to your kids about coronavirus, honestly, if you just Google it, tons of stuff will come up. Someone said earlier CNN wasn't a good news source. The New York Times, but now we're talking psychosocial stuff. So the objection to CNN was, hey, it wasn't science. New York Times actually has a great article. I'm going to play both sides, right? New York Times just had a great article on how to talk to kids about coronavirus. There's also a great website called Vital Talk, okay? Vital Talk. If you look at that, if you're not used to having your kids at home, look for things like homeschooling activities. Me personally, I love to cook. I mean, what chemist doesn't, right? Plus, I learned to cook, way back in the hills, in the Ozarks. Grandpa had a still, and Granny was a great cook. So naturally, I grew up to be a chemist and a healthcare provider, and I bring all that molecular chemistry into the kitchen. And so that's the first thing I think of when I think about keeping kids amused is either hot rodding engines or blowing stuff up in the kitchen. Don't neglect the psychosocial side to this in terms of how to talk to your kid, let them know what's going on. Don't forget that if your loved ones wind up going to the hospital, that all hospitals are severely restricting visitation right now. So you need to do things like be prepared, to FaceTime. Make sure that if you have a loved one admitted for something else, say a surgery, whatever, that you set them up with mobile devices so that you can televisit, right? I can't emphasize that enough. And I think most of you are pretty skilled at that, especially since we've got people calling in from England and things. But don't neglect that. Remember that if one of your loved ones is hospitalized, whether it's for COVID or not, you need to think about ways to use FaceTime and other live chat methods and make sure that it happens. You may need to designate a loved one as the designated visitor that goes. And then, when that person's there, you talk to everyone else. And I'm not ignoring the questions, guys. Again, I just came prepared with a ton of stuff to talk to you about. So I'm working through a few of my points, and then I'll drop back and pick up some of your questions. One of the things, people are always asking, hey, how long will this last? Is it going to get worse before it gets better? Things like that. And I keep saying, hey, it's specific to where you're at. So I wanted to throw out another resource. And again, we'll make sure these wind up on the facts. IHME, okay? So India Hotel Mike Echo, and that's COVID-19 projections. So if you go to IHME, it does projections. If you just Google IHME, and if you don't use Google, use whatever your favorite search engine is. I don't mean to exclude anyone. I'm just Google has kind of become a verb, like Xerox. So COVID-19 projections, IHME, India Hotel Mike Echo. You can look up COVID both by country as well as by specific state. So if you're curious about how things are currently in your region on the healthcare side or how they're likely to evolve, again, India Hotel Mike Echo, IHME, COVID-19 projection. One of the reasons we're doing this webinar, and one of the things that's so important when we start talking about medically fragile patients, what's the worst thing? It's the uncertainty. So the whole point here is to educate you, empower you, just like hopefully you've experienced from day one when your child or your loved one was diagnosed. Okay, so trying to throw some resources out there for you. Okay, and yay, Danny. Again, I know I already said it, but exactly. Yay, CDH parents, you got this. Okay, I can tell you guys, I used to be on the board of directors for a cystic fibrosis charity, and exactly, you guys, parents of chronically ill children, just some of the best, strongest people I've ever met in my life. And you are exceptionally well prepared to handle this. Isabella. Okay. I believe this is a difficult question to answer still. Let's put it forward. 3-year-old son, damage to the lungs. Is the risk that the infection will result in a severe illness higher than for other kids? Absolutely. Absolutely. I'm not going to split hairs there. Okay. Pre-existing conditions, particularly pre-existing pulmonary conditions, definitely. Okay. That may not have been what you want to hear, but sorry, I don't do unicorns and rainbows. If I give you an answer and it sounds like I'm minimizing risk, that's because my answer is based in science. If I give you an answer and I say your loved one's at increased risk, that's because my answer is based in science. Okay. The fact that his lungs, so you are correct. Severe illnesses, more complications are to be expected. Absolutely. But pre-existing conditions do, particularly pre-existing pulmonary conditions, to predispose. It's a strike against you. Okay. So again, just be extra cautious with that social distancing, extra cautious with what you bring in the house. I know it sounds silly, but things like going to the grocery store, that's why we keep bringing it up. Okay. Dawn. Dawn's trying to educate and empower me and reassure me. Let's see, what have we got? I think the faces are just concerned about the virus. So our families are not quiet about how they feel. If anyone has an issue, they will speak up. Situation of the virus is upsetting, probably the emojis. Absolutely, Dawn, but I can't emphasize enough as a scientist, right? We come up with hypothesis, and a hypothesis is neither accepted or rejected, right? Supported. So multiple possibilities there. It's a possibility that people are sending frowny faces because, crap, it's the virus. One more thing I got to worry about with my child. But by the same token, the whole point of the webinar is that it's for our families. So if anyone does have a concern, I don't want them to be worried about offending me. I want them to jump right out there, put the concern out, and let me meet it head on, because I have no ego, and my only concern is that we help educate and empower our CDH patients. So if you're sending frownies because boo hiss COVID, strong work. If you're sending frownies because of boo hiss me, feel free to put it out there, and I'll do anything I can to address your concerns, because I'm here for you. Heidi, as the parent of a child who was on TPN for nearly 19 years, pretty good at all of this by now. Frustration we are finding. Hang on, see more. Social structure in our local community that people don't need to be so cautious. Okay, hang on. Okay. Any suggestions on how we can help them to better understand why herd immunity? Gosh, Heidi, I mean, I'm trying to get I understand where you're coming from. I don't know the community that you live in or the folks that you're interacting with, but they are. dismiss your concerns more specific to medically complex people. Again, I'm not privy to the conversation. I wish I could be, because I'd be happy to address, I'd be happy to jump into the dialogue and facilitate and moderate for both sides. But the suggestions on how we can help them to better understand why herd immunity and letting go of the isolations, and it's acceptable risk. If they want to say, oh, well, only 1 in 1,000 people die, what if that 1 in 1,000 person was your mother? That's how I teach my residents every July. It's Smith's your mother principle, your mama, right? What if it was your mama, right? I teach all my baby doctors, all my nurses, right, that every patient, just pretend it's your mother in the bed space and don't tell me you don't like your mother. So it's easy for people to throw things out there like herd immunity and when they think it doesn't apply to them, right? When they depersonalize it. So one of the ways that I try and wake people up is personalizing things, okay? Right? That would be one thing I would say, just basic psychology, Heidi, is try and personalize it for them. Again, general advice for a specific situation, but I hope it helps. Danny, science says it's not affecting children as much as adults, so risk is reduced. Again, science, that's another word. I keep telling people I wish everyone acted like a surgeon and used their words like a scalpel. Science is kind of a imprecise word, but yeah, our epidemiology, absolutely. And then we say not affecting. Well, what do we mean by not affecting? Do we mean children don't become fulminantly symptomatic to the same degree as adults? Yeah, actually, that is what we mean. So we're seeing less children with fewer serious complications, absolutely. That being said, I don't want anyone to be cavalier. So when we say risk is reduced, that's no reason to ignore good infection control, which I know you didn't say that, Danny. I know you didn't say that, but I'm just making it clear. I don't want anyone to go, oh, kids don't get COVID and be blah, blah. I want to be absolutely clear on that, okay? Yes, we are seeing less COVID in children than we are in adults, and yes, we are seeing less severe COVID in children than we are in adults, okay? But that's no reason to let our guard down, okay? And I know you didn't say we should, Danny, so I'm just making my point clear. Okay, Dawn, this is also the same reason why I told my 2 healthcare providers, to stay away from their son and their grandchild if they wanted to reduce risk even further. Okay, so it comes down to what's acceptable risk. Again, best way to win a bar fight: don't go into bars. Dawn from Marcia Anita, I keep seeing our vitamin regime does nothing to build my son's immune system. Is this true? Okay. So Marcia, there's a lot of, I'm not going to tell you not to use vitamins, and especially not going to tell you not to use zinc. Zinc is a cofactor in so many, people are like, oh, people that don't know better go, oh yeah, naturopathic, homeopathic, nonsense. No, zinc is a cofactor in many biochemical processes. Okay, zinc, magnesium. Okay, I don't know what kind of doses you're giving, but as long as you're giving medically reasonable doses and there's no contraindication, absolutely, please keep on keeping on. Again, you kind of said multiple things built into one question. You say it's doing nothing to build your son's immune system, but kind of going back to the point that I was making with Danny is what parameters are we looking at? When you say it does nothing to build his son's immune system, what are you looking at? Are you looking at lymphocyte counts or what? In other words, for all you know, your son has fought off multiple infections because of the vitamin C and zinc that you've been giving him, right? And it could just be the parameters that your healthcare team is looking at as an indication of immune function haven't shown change, but that your son's responding in another way. When we talk about vitamin C and zinc specifically, honestly, very little risk of it hurting a patient. And some probability of it helping, right? So it doesn't hurt, right? It doesn't hurt to give it, okay? And again, zinc also affects a lot of absorption and metabolism of various other micronutrients and things. So we actually actively use zinc, for example, in diarrheal pathology such as gastroenteritis, cholera, Ebola. Zinc's a very, very helpful cofactor. So I wouldn't necessarily say that it does nothing to build your son's immune system. And I would say that, hey, it's probably, as long as you're giving medically reasonably doses, he's unlikely to come to harm. So it's not going to hurt him. It might help him. Unless your healthcare provider gives you a specific reason not to. Because remember, I'm not going to second guess your team, okay? But unless there's a very specific reason not to, I would say you're fine to continue. Okay. Heidi's in Boise. Heidi, I'm so sorry. I don't remember why you're telling me where you're from. I'm going to scroll up just to see if I've overlooked a question from you. There had to be some reason you said you were from Boise, but I apologize. Okay. So Heidi, I don't know if you replied to the group in general. I see you said earlier that you got a medically fragile child on non-invasive. Okay, but I'm not seeing anything with reference to your location. So please shoot me another line real quick if there's something you need me to address relative to Boise, and I'll be happy to. I apologize for not being able to find it quickly. As far as why you're telling me you're from Boise, or if you're communicating with someone else. But if there's something you need me to say, again, I'm here for you. So just restate it, and I'll be happy to take another swing at it. Regina, I'm a CDH survivor, don't know much about it. I cut hair when the salons open back up. Should I hang back, or am I overreacting? Regina, you actually have two things going for you, okay? And you have no way of knowing. But one of my hobbies, one of the things that I'm into, of course, is old-time barbershops, right? And so, like, for example, when I trim my beard and my razors this morning, what did I use? Barbicide, right? Right? I would never tell someone, I shouldn't say never, I don't like to use the word overreacting, okay? However, because you're a CDH survivor and you're used to working in a professional environment where you're constantly sterilizing your instruments in between sessions, you're actually more prepared than the population at large. Okay? You do better infection control than probably the vast majority of the people around you. So I see no reason for you not to go back to work. Okay. Again, there may be something specific about your CDH and your medical profile, but just CDH survivor in general and working in a hair salon in general, absolutely no reason for you not to go back to work based on that criteria. If you do have a specific concern that you don't want to type out in the open, feel free to just send it privately and I can respond there. But generally speaking, absolutely no reason for you not to go back to work. And in fact, you're probably a little bit more prepared than the population at large because it's a part of your job to exercise good infection control in between patients. One moment, Dawn, I saw something flash on my screen where you were trying to get my attention, but I'm not seeing it here. I'm scrolling. I'm trying to find it. Is this an old notification? What do we got? Okay. Dawn's just saying thanks. So, Dawn, is that a nice way of saying we need to wrap it up? And we probably do need to wrap it up because, ironically enough, I have some NICU work that I have to do in about an hour. Okay, good. Okay, good deal. Let me navigate back a little bit. So I do want to wrap it up in the next few moments because, again, I do have a 1700. I know we originally only going to do this for 30 minutes, and we've gone way over that. But again, it's all about you guys. So as long as you were sending questions, I was happy to make time for you. If you have more questions, I am going to dog it off because I do need to get ready for this NICU stuff. So sorry, dog it off. Nautical slang, meaning I'm going to bring this to a close. This will be uploaded to YouTube. Again, I know it was very unstructured, but hopefully it was good for you guys. It'll be uploaded to YouTube. You can post questions there, or you can send on questions offline, and we'll try and get a fax document up, posted, whatever, available to you as quickly as reasonably possible. Okay. I really appreciate all of you coming out. Again, I'm always super grateful to, I talk about it, but it's not a joke. I work with all kinds of different medical kids, and I have a super, super soft spot for my CDH babies because honestly, I learned so many lessons in taking care of them that are applicable to so many other patient populations across the board, both in terms of physiology as well as psychosocial. So I've got a horrible soft spot for you guys. So please don't hesitate to take advantage of it. Okay. Feel free to send your questions to Dawn. I'll do everything I can to get them answered in a timely manner. And again, thank you so much for coming out. Thank you so much for hanging out. And I will talk to you via the fax. And if need be, we can do one-on-one or do another session. Please do not let your questions go unanswered, though. You're no trouble at all, and I'm happy to help. Okay? All right. Thanks so much, guys. Have a wonderful day. Again, stay safe, stay sane, and stay sanitary. Cannot emphasize it enough. Good infection control. Okay? And I'll post those resources about going to the grocery store and entering your home. All right? Take care, guys. You've been awesome.